Hey everyone, it's your host Davia, and we're breaking down the importance of prevention and early intervention in behavioral health and how supporting kids and families early can make a lasting difference. Joining me is Dr. Corey Richardson, the CEO and Clinical Director of ICGH. Dr. Richardson, thank you so much for being here.
Thank you for having me.
Of course. So, treatment is critical and prevention matters too.
Absolutely.
We know that, right? So how is ICGH working with schools and families to intervene earlier?
So looking at behavioral health and looking at addiction, keep in mind that it's no different than any other medical condition, not like diabetes, cancer, hypertension. Looking at prevention has been an essential part. And I don't just mean prevention in our school systems, which obviously has begun earlier and earlier, but like at home, messaging to kids that you don't have to use, we don't drink, that type of messaging is essential to addressing the problem that the society has. Similarly, early intervention. Would you rather catch cancer at stage 4 or stage 1? Yeah, clearly, you want to catch cancer as soon as you can. You want to intervene with diabetes as soon as you can. The problem is that addiction and mental health is stigmatized where cancer and diabetes is not. So if you have a family member and you have this messaging in your home that it's a moral failing, you may want to pretend it's not happening, you may want to pretend that it's going to go away, rather than saying, hey, as a family, we need to get the help now before it goes any further. And so what I say to you is, if you have a problem, be sure you go to a licensed addiction treatment provider. If you have a mental health problem, go to a mental health provider immediately.
Yes.
Don't wait till you have something catastrophic like an overdose or like a suicide.
Yeah, and that's a great point. Like, a lot of people do wait, and even like for other things, or if they notice something, they're like, I'm just gonna brush it off, it's fine. It's just always make sure to get checked up for sure if you notice something's off.
To get an assessment, to look at early intervention, it's the best way to go. But go to a licensed provider who has a skill set, especially when it comes to kids.
Speaking of kids, they can especially be more vulnerable to stress and difficulties at such a young age. So why is school-based therapy such an important part of behavioral health care?
A lot of times with our school-based therapy program, like the one in Carteret County, we have counselors and therapists inside the school system, so they're readily available for kids. It's such a challenge, especially with some parents that have economic problems with transportation and others, to make our therapists available during the regular school day. And they're able to address any of those mental health problems, ADHD, oppositional disorder, any trauma, those other problems as well, that would not otherwise be taken care of. And they also can have early intervention on any kind of substance use that might be found. And so I think it's key to, like I said, early intervention is successful outcomes.
And so how does early intervention change long-term outcomes for kids and families?
Kids that have early substance use statistically will be adults with severe substance use disorder with those horrible outcomes. And so the earlier the intervention, the better the treatment outcomes and long-term success.
So lastly, if there's one message you want the community to take away, what would it be?
Don't wait. Get help today. Help is free. We'll help you get Medicaid. If you're not qualifying for Medicaid, we have federal funds. Just don't wait. If it's your kid, if it's a loved one, if it's a friend, intervene as soon as you can so that you can save a life.
Dr. Richardson, you all are making such a huge difference, and I appreciate you for being here and sharing. Very informative.
Thank you for having me today, David.
Of course.